what happens when you plateau on the medicine you're using for weight loss and you start gaining your weight back? This is a good question.
This is a really good question. A lot of people experience this. Yeah, this is not atypical, Robert. So the first thing is, it doesn't mean you're doing anything wrong. Right. So
your body is programmed.
Yes. Let's talk about why this happens, and then we'll talk about what to do about it. Right. So the why is exactly what Dr. Simon just said. Your body is actually defending the higher weight. So when you start losing weight and your weight is here, as you start losing and your body weight comes down, a defense system ramps up to try to push you back, right? Imagine like a rubber band being pulled. The resistance builds and builds and builds and builds. And that's why if you let go, it snaps back up, right? You get back to that higher weight.
It's not a character flaw.
Not at all. No, it's not that you're doing something wrong. It's not that you've changed something. It's really metabolic processes that kick in as early as 8 to 10 weeks into weight loss. And what is happening is the one hormone that makes you feel hungry, called ghrelin, right? Think of your stomach is growling. Ghrelin goes up as your body weight goes down.
Makes you more hungry.
Yeah, so you're more hungry than you were. And there's a bunch of hormones that help you feel full, and those go down. So you're more hungry, you're less full. And then what happens to metabolism?
That's right. The metabolism goes down.
Yeah.
You got it.
It's a protective mechanism, right? If you know anyone who accidentally lost weight and they were not ill, let us know, because we don't know anyone like that, right? It is purposeful when we lose. It can be accidental to gain because the body is happy to protect you with extra calories in case a famine comes.
That's right.
That's never good.
Not in this country.
Not in this country.
I mean, I suppose it could, but some sort of cataclysmic event. But in our lifetimes, in the last 100 years, this is not
hasn't happened yet. Yes.
In civilized Western society, it's overabundance. We do live in a very good time in world history.
Indeed.
But we inherited a genetic code and a physiology that protected us against those sort of things that weren't so pleasant that happened before that. And so that's the way our bodies are operating, according to that system, right? So look, one of the things I have said many times on this show before, that there are 4 pillars when you treat obesity. There's nutrition and physical activity and behavioral modification, and then medications or pharmacology, or however you want to say that, right? So you do have to pay attention to what you eat. You can't, this is not a time to be lax. This is a time to pay very close attention to detail and to really batten down the hatches on your intake, and to make sure that you're not allowing carbohydrates to slip in there, or excess calories in some form or the other that wasn't there before, that you're now slipping in there. This is a time to be physically active. Your metabolic rate has gone down, and if you've lost weight, this is the one time. Exercise doesn't really help you lose weight as much as it helps you prevent weight regain. So it makes a difference here. Okay, and then to be able to do those first 2 things, you have to change behaviors to do it, right? So I won't say too much about the behavioral modification at this point, but then the 4th point is medications, and you maybe need an adjustment in those. Maybe we need to add some more. And I keep harping on the idea of combination drug therapy, getting the doses right and using several medications from different classes at one time. Those may include things like phentermine, a classic appetite suppressant, things like topiramate, which we often use with phentermine, things like metformin, and then things like the newer injectables, what we call the GLP-1s. Those fall under common names like Ozempic and Wegovy and Mounjaro and semaglutide. These are things that can be used in combination for weight loss and long-term weight maintenance, and they're very, very effective when they're used in combination. And a lot of people have this idea that they just take one thing, and that if they take another thing, they have to quit taking the one thing. And no, they work together. It's like a fruit salad, right? A fruit salad, you can have several pieces of fruit in there, and it's not bad. It's good. maybe that's not the best analogy when I'll talk about carb restriction, but you get the concept, I think.
Yeah. So these medications, they are prescribed by medical providers such as nurse practitioner like me, physician assistants, right? MDs, DOs. These are not supplements we're getting offline. These are pharmaceutical drugs that have been through clinical trials and proven to be effective. Now, what we do in our practice, which is progressive, even though it shouldn't be, is this combination therapy. We've been doing it in cardiac medicine forever, right? Not a lot of people, even if you take one pill, not a lot of people realize there's usually 2 medications in that one pill.
Yeah, that's right.
It's usually a diuretic with another blood pressure lowering medication. We do the same thing in medicine. It's just not many of them already come in combination, so we are using 2 of them.
Yeah, and if you think about it bigger than that whole scope of heart disease, people will be taking aspirin, they'll be taking lipid-lowering agents, they'll be taking 2 or 3 different types of blood pressure medications. This is combination drug therapy that extends people's lives. In that scenario, we treat obesity the same way, okay? And for those of you who have been here, yes, we have an on-site pharmacy. I got to tell you, and some of you may perceive this to be arrogant. I don't think it's arrogant. I just think it's a statement of the truth. Is that I think we're one of the only practices that does this. I just don't see a lot of people doing it. I see them talking about one medication, and then maybe they put you on some vitamins or something like that. But in terms of prescription medications that are specifically approved by the FDA to help you lose weight, are designed to do that, I don't see many practitioners doing this. I'm alarmed by how many of them aren't doing it. And the information is there in the medical literature, and you and I have been trained how to do this and have been doing it for years, and it's very, very successful. But yet when I search for other practices that I can send people to, and say someone moves to a different place and they say, would you refer me to a place? And I start looking around for a place. I can't find anybody else that does it, right? And so it's like, wow, what is the hang up here with the medical community over this? So anyway, it's kind of discouraging in a lot of ways, but we're working on, there are organizations like the Obesity Medicine Association, for example, that are working on training more providers to do this sort of thing, right? More people out there doing it like us, so that patients will have a place that they can go and be afforded these services.
Yeah. So basically, Robin, give us a call. We would help you figure out, right, if the medicine that you're taking got you to a certain point, it did a wonderful job, but now it may be just working for weight maintenance or not working well enough to keep the weight off. And after we maybe add something else, we can get another layer of success under you.